My name is Satyajit. I'm professor of HIV medicine and a consultant physician in a teaching hospital in UK. I'm going to do a short presentation of a classic case of coronavirus illness in a young man who has been receiving treatment in this country. Coronavirus disease 2019 is defined as illness caused by a novel coronavirus now called severe acute respiratory syndrome coronavirus 2, or in short SARS-CoV-2. The virus has got spiky projections and under the electron microscope looks like solar corona and also gives a crown-like appearance, hence called coronavirus and now in short called COVID-19. Here I am presenting a 43 years old Italian young man who lives in UK. He presented with a 2 days history of dry cough and fever. He started feeling increasingly short of breath and was admitted in the hospital. At the time of admission, apart from his complaints of fever, dry cough and shortness of breath, he had fast heart rate and all his other observations were normal. His chest was clear and examination of other systems was normal. He was normally fit and healthy and he had no history of past medical illness. This is the chest X-ray he had 3 months ago for some other reason, and we can see it was normal. Soon after his admission in the hospital, his condition rapidly deteriorated, and this is the chest X-ray 1 day after his admission. We can see the chest X-ray is now grossly abnormal with multiple opacities, large and small, on both sides. Now this is the chest X-ray on day 3 of his admission. We can see the shadows on both sides are now confluent and occupying larger areas of the lung. This is typical of acute respiratory distress syndrome. He now had multiple organ failure and was already transferred to intensive care unit and he was on ventilation. He is still in intensive care unit on ventilation and fighting for his life. So, here is a fit and healthy young man of no past medical illness presented with classic symptoms of COVID illness which rapidly deteriorated to a life-threatening situation. This case highlights that COVID disease can be serious in any age group and can deteriorate rapidly even in fit and healthy adults. There may be several complications, and this is a list of some of the common complications which leads to severity of the disease. I have prepared this list from a research from China recently published in British Medical Journal. This study included the information of 273 severe cases, of which 113 cases sadly passed away. The colored ones in the list are the most common ones, with acute respiratory distress syndrome being the most commonest complication. Then comes acute cardiac injury, heart failure and sepsis. The study showed that patients who are known to have hypertension have higher risk of developing complications of acute cardiac injury and or heart failure. Several mechanisms have been proposed or suggested, with some has definite role and some still as postulations or possibilities. So far, we do not have any measure to actively fight against this virus, several drugs or agents have been tried and will be tried, but so far there is no definite evidence of any remedy from this infection. So the only way so far is to offer support to the patients and their families and prevent others from getting the infection. Different countries have adopted policies of halting the transmission of the infection, but it may require a long time before we get on top of the infection. We have to work together across the whole world, and we shall definitely overcome one day. And I very much wish that the day is not far from today. Thank you.